Are you finding that you're in pain more and more often? Did you know that a lot of your everyday aches can be attributed to an alignment issue within your body? With the right chiropractor, you won't have to keep living with the pain. A proper adjustment can be the perfect solution. Today's local expert is here to speak specifically about chiropractic adjustments and how they can literally transform your life.
I'm Dr. Malcolm Williams. I'd like to talk about the role of chiropractic and the role of chiropractors. The role of chiropractic care is the restoration of communication between the brain and all parts of the body. The brain is protected by the skull, and the extension of the brain is the spinal cord, which is protected by the spine. The skull is a fairly solid structure with very little movement between the bones. Nerves exit from the brain through actual holes in the bones. This would be ideal for the spine in terms of protection, but then we'd lose mobility. So there's a compromise of the spinal column being made of many small bones with spacers called discs between the bones to separate and cushion them, and to allow movement in many directions. The nerves exit between the bones, going to every blood vessel, muscle, and organ in the body. When the vertebrae of the spine are in alignment, the communication happens freely to and from the brain. If one or more of the vertebrae get stuck in a position, there is mechanical discomfort from the joint surfaces at that level, but also the potential of altered nerve communication. For example, if there is a misalignment in the neck, it can cause pain, tingling, and/or numbness down the arm and into the fingers. The role of the chiropractor is to locate the level of that joint malfunction in the spine and then to correct it. Chiropractors use a range of methods to identify where the problem is and many different techniques by which to correct that misalignment. All of the different adjustment techniques work. Why then does technique matter? First is what the chiropractor is most comfortable and confident in doing. We all have different personalities and preferences in how we approach things, and when we learn about the different techniques, each chiropractor is drawn to the technique or techniques that resonate with their style of doing things and their philosophy. The second answer is that it matters to the patient. Each patient has their preference for how they like the correction to be made. Some people like to have very solid thrust and audible click. To others, this is a terrifying thought, so they prefer one of the gentler methods. In my practice, I have combined a range of adjusting techniques on the gentler side of the spectrum. I use low-force procedures including instrument adjusting, gravitational blocking, and some low-force manual adjusting. These procedures eliminate the fears that some people have about being adjusted, for example, of having their neck twisted and snapped. I incorporate the Sigma ultraline adjusting system in my practice. This system uses NASA technology with a sensor in the probe that measures the resistance at each spinal level and graphs this on a computer screen, from which I can determine which areas are in need of work. With the instrument in treatment mode, I apply it to that segment. It delivers multiple light thrusts while measuring the resistance in the joint and shuts off when there is no further change in the resistance at that joint. A rescan shows what has changed, giving immediate feedback about the success of the correction. I can show the patient the before and after scan images on the computer screen. Just as lasers have replaced scalpels in some surgeries, advanced technology has become available to chiropractors to assist in delivering chiropractic adjustments. I'm also trained in Activator Methods and use the impulse adjusting instrument. These methods have systems of analysis and use the instrument to deliver the thrust at the indicated level. Another approach I use is sacrooccipital technique, SOT, which includes using wedges placed under the pelvis to gravitationally align the structure. While the structure is rebalancing on the wedges, the position also helps the muscles to relax. SOT incorporates many other components of adjusting using light force manual adjusting and reflex work. I use SOT, the Sigma system, and manual methods to realign other joints in the body, such as the jaw, shoulders, wrists, hips, and knees. The chiropractor's hands are sensitive and honed instruments for feeling what is happening with the bones and muscles and in feeling what is normal or abnormal motion at the joint levels. Combining this with the high-tech approach of the Sigma ultraline scanning system brings a level of advancement to my analysis, both in identifying more specifically not only which areas to adjust, but the order of priority for the adjustments. Through the rescan, it shows what has been accomplished and what more might need to be done. I love the combination of using my sensory skills complemented by the high-tech information. Once I have determined what needs to be addressed, I have the range of treatment options from the various techniques that I use and can match what I do to the patient's preferences and comfort.
There you go. Your search doesn't have to be stressful. As a matter of fact, the right chiropractor will make it easy. Are you hoping to learn more? Today's expert can be reached at the number on your screen. See you next time.